It's time to dive into a heated debate that's affecting a lot of lives here in Minnesota. The MinnesotaCare debate. So, what's going on? House File 10, or HF10 for short, is a new bill proposed by some Minnesota Republicans. This bill wants to roll back a 2023 law that expanded MinnesotaCare, a low-income health program, to include undocumented non-citizens. This law just went into effect at the start of 2025, but now, it's under threat. Supporters of HF10 argue that repealing this law could save the state around $99 million over the next 2 years. They believe it stops what they call the redistribution of wealth away from tax-paying citizens. Representative Isaac Schultz is one of the main voices behind this push. But hold up, there's a lot of opposition to this bill. Major medical organizations like the Minnesota Medical Association and the American Cancer Society are warning that repealing this law could lead to some pretty serious public health issues. They say it might increase emergency room visits and lower reimbursement rates for healthcare providers. Jennifer Decubelis, the CEO of Hennepin Healthcare, and Irene Fernando, chair of the Hennepin County Board, have even called it a serious public health threat. Labor groups are also voicing their concerns. SEIU Local 26 argues that the bill doesn't address the real issue of rising healthcare costs and unfairly targets immigrant families. On the flip side, the Center for the American Experiment supports HF10, claiming that expanding MinnesotaCare to undocumented individuals increases the risk of fraud. They argue there's not enough proof required to verify undocumented status. So, where do we stand now? The bill has already passed the Health, Finance and Policy Committee by a narrow 11-10 vote and is moving to the State and Local Government Committee. Right now, Republicans have a temporary majority in the House, but this could change with a special election coming up in March. If the Democrats win, the House might go back to a 67-67 tie, which would definitely shake things up. One more thing. State officials still don't know exactly how many undocumented individuals have enrolled in MinnesotaCare since the 2023 expansion, so there's a lot of uncertainty here. Alright folks, that's the lowdown on the MinnesotaCare debate. It's a complicated issue with passionate arguments on both sides. What do you think? Should MinnesotaCare continue to cover undocumented non-citizens, or should it be rolled back? Let me know in the comments below. Until next time, stay informed.